And I am the Assistant Vice President of Programs at South Arts, and it is my pleasure to welcome you today to one of our professional development workshops. I would like to let you know that South Arts does receive support from the NEA through a partnership agreement to produce workshops such as these and conduct additional programs for our constituents across the region. Please visit our website as well as the NEA's website for additional information and opportunities. And we are fortunate today to have Adrienne Hunley here with us. Adrienne is from Arts Pharmacy, and Arts Pharmacy, and I'm going to try to get this right, is a arts-based social prescribing
organization.
company.
Yeah.
Yes. Yay. All right. So I'm excited to learn about this, and I am going to go ahead and turn it over to Adrienne. I would like to invite you to introduce yourself if you'd like in the chat. We also have the Q&A feature enabled. So as you have questions, you feel free to enter them in the Q&A, and then at the end, we'll go through those and Adrienne will answer your questions live. And we will also be sending out the presentation afterwards. So don't feel like you have to take copious notes because you will have access to that. All right. Thank you. Welcome, Adrienne.
Thank you so much, Hillary. Good morning, everybody. It's really good to be here with you today. My name is Adrienne Hunley. I am a white middle-aged woman with brown hair pulled back in a ponytail and a blue and white striped shirt. I promise it's blue and white. It's not black and gold or whatever that dress was. I'm really excited to be here with you all to be able to introduce the idea of arts-based social prescribing, give a background in that work, and then share a little bit about Art Pharmacy and our work and our model in the arts and health space. Just to reiterate what Hillary said, if you have questions, please drop them in the Q&A. I will be going through a presentation and then open it up to questions and conversation at the end of that presentation. All right, here we go. Share my screen. So, like I said, my name is Adrienne. I am the head of community strategy with Art Pharmacy. My background is in arts and education and community well-being, and have worked in the cross-sector arts space for more than a decade, moving to specifically the arts and health intersection over the past almost 4 years. Art Pharmacy is an arts-based social prescribing company based in Atlanta, Georgia. Today will be this introduction to social prescribing and arts-based arts and health research primarily, but I'll share more about our work as we go. Arts-based social prescribing, also sometimes called arts on prescription. So if you hear either one of those, it's talking about kind of the same thing, marries two fields of practice. It uniquely combines the proven efficacy of arts and health with a community-based care model of social prescribing. 40+ years of research at institutions like Johns Hopkins, Duke, Harvard, University of Florida, and the World Health Organization that have demonstrated what you likely already know, is that engagement with the arts reduces anxiety, depression, and social isolation. It's a confirmation of what artists since the beginning of time could tell you, that art heals. This is something that as arts practitioners we see in the folks that we work with and that we feel in ourselves when we're engaging in arts practice ourselves. The research that goes into that part of the decades of research, one current practice is neuroaesthetics, and they have looked at the physiological impact of arts on our body. The arts evoke emotion, it evokes feelings, reactions, and the stronger the reaction, the greater the moment of salience. Salience in the field of neuroscience is important because it strengthens that bond or connection, the synapse, in the brain where neurons connect and communicate with each other. And so as the NeuroArts blueprint really beautifully states, it shows that physiologically, the stimulus from art on our senses causes this cascade of reactions that affect multiple biological systems that alter our brains and our bodies. In short, we are wired for art. So when we talk about rewiring the brain, relaying positive tracks, healing previously damaged neural pathways, whether they're damaged from disease or trauma, we're talking about neuroplasticity, which is the nervous system's ability to change its activity by reorganizing its structure or functions or connections. This neuroplasticity is aided during those salient moments. And so as we look at the impact of arts on both physical and mental well-being, that's the power that we're talking about when we kind of tap into arts and culture to create salient moments that encourage healing and well-being for people. There's a lot of other research that looks at kind of the emotional impact, the cultural impact, the social impact of engaging with the arts. The neuroaesthetics and the NeuroArts blueprint is kind of one pathway and one taste of that field of research. The mechanisms for this artistic aesthetic experience in the neuroaesthetics field is one piece, like I said. The other part of the embodied research, as we learn more and are able to conceptualize kind of the physiological basis for our experience of art, is really helpful as we can inform how we frame and build creative programs and experiences for the whole person that looks at the emotional and mental side as well as physiological impact. So I'd love to invite you to, for a moment, kind of forget the neurons for a minute, forget the science of the research that I just shared, and kind of tap back into that emotions piece and the values that maybe you've experienced in your artwork, either as a practitioner or as a teaching artist or as an arts administrator, seeing the impact on audiences or participants in workshops. Take some time to reflect on the experience that you've had and kind of think about an experience that was extra impactful because some form of arts was involved. And think about maybe how would that experience have been different if arts weren't a piece of it. When I think about this, I often think about the sense of belonging that I carry to this day from with previous castmates in a theater production versus previous soccer teammates. Loved both, did both through middle school and high school. Though the similar functions of team building were at play, we'd shared objectives. There was obviously high stakes performances. We had really focused time together. We had unstructured time together. But there's something about a connection with my castmates that, we shared this collective aesthetic experience that tapped into a wider, more whole me. And I think that that experience, that kind of tapping into the arts that opened a different level of connection that was possible. So that's kind of the science research that impacts and informs and illustrates kind of the embodied experience as an illustration. So going to the other side of that equation is the social prescribing. So social prescribing is the mechanism that is the means of enabling health professionals to prescribe community-based social interventions as supplements to traditional care and pharmaceutical care. It began in the UK and other countries with more socialized health systems And they've seen success with implementing social prescribing at scale. Um, Obviously, the US healthcare system is a very different kind of system. And so the adoption of arts-based social prescribing in the US is a little bit more challenging. And Art Pharmacy is working on building a platform that's adapting it to fit into the US healthcare system, and elevating it to meet kind of the medical grade needs that's required. This means that, we think about, while community referrals have been given by doctors for decades, um, the closed loop system of social prescribing that integrates it back into a person's care plan needs to look a little bit different. So we integrate that by practicing a person-centered and precision medicine approach with individualized care plans and tailored recommendations for creative engagements. And we communicate that all of that activity back to referring providers who have made the prescription, who have written that referral, so that we're able to kind of be part of the full care team throughout a participant or a member's prescription. Social prescribing as a practice really refers to that connection to any non-clinical community-based intervention. It doesn't necessarily have to be arts and culture. There are social prescriptions for exercise, for food, for volunteerism. Um, the arts-based social prescribing field, or arts on prescription, is really looking at that kind of subsector of social prescribing in order to make sure that it's recognized as a really essential piece, and doesn't come in secondary status to other really important and other essential needs, as we think about, housing and food and other social services, making sure that it stays elevated as an essential piece in somebody's well-being. Social prescribing itself produces really notable outcomes. In the UK, the research is showing that it increases self-esteem and confidence. It's improving mental well-being and positive mood. It can reduce anxiety, depression, um, on the mental health side. It also is showing really important impact in improving physical health, improvement in weight, control of blood pressure, lowered cholesterol levels, and increased physical activity. I think the connection from, the self-esteem, the confidence, the positive mood, the sense of belonging, is something that I saw as a theater practitioner and as a theater teaching artist for a number of years. And so that, you know, is a really, and like yeah, of course moment for me in this work. But to see the research that shows that is, I think, really exciting and really impactful. So um, we're excited to see that kind of take place in other countries and want to make sure that that is established here in the US as well. As a kind of an overview of the whole field of arts and health, um, I want to take a moment to kind of clarify different sectors in that. And as we get, as the field gets more nuanced and gets more mature, kind of understanding the difference of these different types and where it fits in, I think is really helpful. So in the overall field of arts and health, we have obviously the creative arts therapies. These are clinically licensed professionals using arts-based activities to help treat emotional and mental health conditions. So your arts therapist, your dance therapist, your music therapist, who are working to utilize the arts as part of a clinical treatment. Then you have arts and health, which is actually in a healthcare setting. That's co-located programming that integrates arts into healthcare settings, bedside music, artists in residence, all that good stuff. Even the design of space, people are thinking about the design of hospitals and clinics, and how that can support healing and well-being. And then arts-based social prescribing is alongside, but a different section than arts and health or the creative arts therapies. And so that is community-based creative engagements, this mechanism to navigate the gap between healthcare settings and community. And it's primarily a non-clinical practice. So the engagements that healthcare providers are referring people to are your local theaters, your local dance classes, your local music schools that are not practicing creative arts therapies, but are just a space for people to engage creatively. How this looks in practice under the art pharmacy model is that I show up at my doctor's appointment with a mental or behavioral health concern. My doctor screens me and, if eligible, refers me to art pharmacy. And then I get connected with a care navigator who uses our smart matching technology that is developed to integrate into EHR systems to make really personalized recommendations for arts and health engagements. These meet my health goals, my arts interests, any access needs that I have. And then I get to choose which of those is particularly exciting to me, works for my schedule. And then the care navigator takes care of all the logistics. They book the ticket, register for the class on my behalf. And then they serve as an accountability partner, really. So we send reminders to our participants before each experience, 48 hours in advance, an hour in advance, saying, remember, take your dose of arts and culture. And then the care navigator follows up after each scheduled experience as well to do a well-being check and see whether I made it or not, and how that experience was for me. Because we've taken this approach from a medical model, we do measure members' progress and provide that data back to the referring provider. A typical prescription is for 12 doses or 12 engagements over 12 months. So we're looking at about a monthly engagement experience. And that model is really pulled from research by Dr. Daisy Fancourt from the University College London, who looked at a broad survey of participants who engaged with arts and showed that regular engagement over time is what creates both the behavior change and impacts kind of the lasting outcomes and effects on people. So that's, rather than a one-off experience or even a intensive of classes, that kind of engaged practice over time is what we're looking to help support people through. There's really, really great momentum for both arts and health and arts-based social prescribing in the US right now. And there's a couple of things that are making it like the moment to meet. And so we're seeing trends that in the healthcare space, that healthcare is moving towards this value-based care model that rewards preventative care. We're seeing a recognized need for mental health supports. Coming out of the pandemic, there's no question that our population and our communities need extra support. The Surgeon General over the past 2 years has named specifically social isolation and anxiety as two major public health concerns in the US. Then we're also seeing just a workforce shortage in mental health and behavioral health providers. And so being able to tap into and leverage programs that are already in the community, already providing really important work, really powerful work is huge. It can be a game changer, especially for communities that are seeing the highest gap in workforce shortage. The work also is supported in trends in the education sector. So looking at social emotional learning that teaches the sensory learning and awareness, that is less and less a new thing, but it translates over into the mental and behavioral health space. And so the recognition of that in education spaces, of the importance of that, and the power of the arts in supporting SEL, is translating into the arts and health space as well. And then in arts and entertainment, coming out of pandemic as well, looking at traditional revenue streams that need to be reimagined and creating programming that is more explicitly connecting the arts with individual and community health, are trends that are increasing the availability and the accessibility for communities. I don't know if I had mentioned it in the last slide as I was talking about the art pharmacy model, but we cover all of the participation costs for participants. And so if that's the, ticket to the theater or the class fee, that is money that is being taken from healthcare dollars and shared with the arts and culture sector. So it is always free for members or participants, but arts partners are never asked to foot the bill. It's really putting a value on what arts and culture organizations are doing and providing as services to the community. We currently serve members in Georgia, California, and Massachusetts. Art Pharmacy is growing and expanding and building a network of arts and culture partners nationally at this point in time. This quote from an Art Pharmacy member in Georgia, I think puts a voice to the impact of, a healing journey that is not linear and a experience that is complex. And we know that the arts have that ability to be nuanced and how it meets people with what they need. So she had shared that she enjoyed the play that she saw. It was really nice to see different cultures than I usually see. There were also lessons, and I love the way it kind of demonstrated life is not always easy and happy, and it can be imperfect and still be good. This is the kind of core essence of what the arts allow for space for people. And so being able to create a model of arts-based social prescribing that has a vision for a scalable solution within the current system is really our goal and what we're moving towards. There are models that are very localized. There are models that a relationship is directly between an arts and culture organization and a local clinic. There are models that are more like art pharmacy, where there's kind of an in-between person, the care navigator or a link worker, who kind of helps play that matchmaker. In any case, like those are all models of arts-based social prescribing, but we are really looking to build a program and a model that can scale. So we contract with healthcare plans, healthcare systems, hospital systems, et cetera, and individual providers who offer services to the clients of those partners. As you can imagine, in order to kind of meet the wide range of the needs and arts and culture interests and desires from different members, the offerings that we look for with partners naturally cover a extensive range of factors. So I'm here as part of this presentation, as in addition to sharing about arts-based social prescribing and the research and the models, is to also invite arts organizations, cultural organizations, individual teaching artists, cultural workers to join the network. We look for and include a range of disciplines from your traditional visual, performing arts, music, et cetera, to non-traditional spaces, history museums, botanical gardens, libraries, senior centers, community centers, that are offering programs that are based in arts or culture, but maybe aren't kind of your traditional arts organization. We're looking for engagements that are delivered in person or virtually, even over the phone. We've got a number of kind of music meditation partners that deliver phone-based services, which is really great for increasing access for those people who maybe are in a low tech area. We're looking for participatory experiences like workshops and classes. We have receptive experiences like going to see a show or going to visit an art gallery. We're looking for a diverse range of institutions, large institutions, small community-based organizations, and individual teaching artists that provide programs in English, in Spanish, in Haitian Creole, in all types of languages, so that we really are able to make a good match with cultural relevance as well. All of our partners that we pull into our network, we ask for them to meet a standard of care, which includes that they center a creative process or product. They promote inclusivity and a sense of belonging. They offer a chance for reflection. They practice mutual respect and agency, and provide connection and engagement. So as you can hear from that kind of standard of care, really the only arts piece that is in there is that it centers a creative process or product. The rest is all about the space and the community and the experience that someone is able to engage with. So my question for you is kind of, how does arts-based social prescribing fit into your work? Maybe you are a very intentional arts and health programmer. Maybe you are not at all. And that is all welcome in the arts-based social prescribing world. You do not have to be a clinical arts therapist for you to be part of the movement, to be part of the momentum that we're seeing at a national scale for the integration of arts and culture into somebody's path towards wellness. As you're kind of considering, how do I get involved? There's many ways. I think the kind of lowest hanging fruit is to join into the Art Pharmacy network of partners. But if you are interested and already kind of engaged with relationships with healthcare providers in your area, there are wonderful resources that I've linked at the end of this program, and we'll shout out here and highlight again later. There's a field guide written by Dr. Tasha Golden, on creating arts-based social prescribing programs in your community that can be done at a very local level. The thoughts about what programming is a really good fit for this is open programming, open offerings that are open and inclusive to members of the public. A thing to consider is, whether there's ticket costs or class fees. Joining the Art Pharmacy network means that we cover those participation costs at the time of booking. The only requirement there is that there's a system set up for us to purchase on behalf of somebody else, or figure out a workaround if needed. If you provide free events because you're already thinking about access, we still make a donation to cover our participants if you're set up to receive it, because free events usually just mean that you've put in a lot of work putting together a grant proposal to underwrite programming, maybe it's from South Arts. We still want to be able to demonstrate and show the value to our healthcare partners, that free events aren't free. If you're joining the network, if you're interested in joining the network, I welcome you to do so. You can fill out an enrollment form. It's a pretty brief, maybe 8-minute form that collects information about your organization, the type of programmings that you offer, and has a couple of attestations for partner agreements and that standard of care that I talked about. So you can go to the link here or use the QR code to do so. Once you have done that, I connect with arts partners to kind of go through the model in a little bit more detail, make sure that all the logistics would easily flow, and then we start pulling in engagements, events, shows, galleries, etc., to our database of offerings. And are then able to send those to members as we have individuals whose profiles meet those programs that you're offering. You heard me say, we are actively filling referrals in Georgia, and that's the only state in the South right now that we are. However, we are in so many conversations because of the momentum that I talked about earlier, that we're building the network nationally. And I, even though I might not have a date that will refer folks in other states in the South, it's really important for us to be able to show that there is the capacity of the arts and culture sector, so that as we're talking to the healthcare side, who don't know or don't have the faith that there are, artists and arts organizations in every community, and don't know that the way that artists work is that if there's not something there and there's a demand for it, then we show up and we create new things. So even, you're welcome to enroll in the network, even if you're not in one of those active areas, because it still shows the momentum and the capacity and the interest from the arts and culture sector to be able to help push forward that more wide-scale adoption of arts-based social prescribing in any given region. So here's a list of some of the resources and research that I've referenced today. The Arts on Prescription Field Guide to U.S. Communities is the one that's written by Dr. Tasha Golden, that you can go into deep dive best practice for creating social prescription programs. The Connection Cure is a wonderful book by Julia Holtz, all about social prescribing, not just arts-based social prescribing, but kind of the mechanism of social prescribing in general. The NeuroArts Blueprint and Your Brain on Art by Dr. Susan Maximin of Johns Hopkins International Arts and Minds Lab. That's where if that science of the neurons and that kind of research of the impact of arts on our bodies is interesting to you, both are fascinating reads, almost enough to make me a science person. I'm not a science person. Those make me a science person. And then the U.S. Surgeon General's initiative to address social isolation and loneliness. The associations of social and cultural engagement in healthcare utilization and the impact of social prescribing are also ones that kind of look at the impact of the mechanism in general. So I will stop there. I'll drop my email in the chat as well, so that if you want to reach out directly to me, would love that. But I want to stop here and open up to questions, because I think it's in the questions and conversation that things really get interesting. So I'm going to stop.
We do have some questions in the Q&A.
Excellent. If you'll read those out, since I have been ignoring it as I've been presenting, that'd be great.
Okay. So we have one thing that appears to be maybe like a comment, but it just says university art museums that have developed in-gallery deep looking curricula for their med school students. And University of Virginia, Charlottesville is a pioneer. So I guess, maybe that's a resource for folks,
Yeah.
if they're interested. Then we have a question from Bama. It's curious to know how progress and impact are measured. Can you explain that piece more?
Yeah, absolutely. So from a clinical side, we look at the clinical impact using the WHO-5 General Wellbeing Index from beginning baseline at intake and then after each experience. We also use some clinical measures, including the UCLA Loneliness Scale and the PHQ ADS, which is the Combined Anxiety and Depression Scale. And then as we make partnerships with different healthcare payers or providers, they're often looking at a specific health concern, whether it's a health inequity piece or, supporting unmanaged hypertension, high blood pressure in patients, whatever piece that they are looking at, we also will help track and measure so that from the get-go, we know what they are looking for to measure a success. And so that way, the healthcare partners are also getting the information that they are interested in.
Awesome. We have another really good question from Kit. As you build the national network, is remote or internet-based providers part of what you're building? So I guess that would be like telehealth.
Yeah, so as we're building the national network of arts and culture partners, the virtual experiences, Zoom classes, all of that good stuff are definitely a part of the network. They're also a really important piece as we look at urban rural gaps in providers. A rural community may have a handful of providers, but maybe a member is looking at a specific type of arts genre that they're interested in. And so we're able to use virtual experiences to kind of fill that gap. They're also really important for folks who may be immunocompromised. And so, many of our referrals from oncology centers are looking for virtual experiences so that they can engage without having to be, in a very crowded space. On the telehealth side, we have referrals coming from a range of different partners, some who are getting it directly from their provider as they're, in the clinic in the doctor's office with them, others that are being referred by kind of case managers at the health plan level. And so, so the range is very wide and very inclusive of telehealth referral. It really depends on the partnership that is set up with the paying provider and the healthcare provider that's doing that referral. So we're pretty agnostic to the kind of type or way that members are referred. That is very much determined by the partnership. We are really just kind of that mechanism of being able to connect folks.
Awesome. Okay, here we have another question. Could a museum providing arts prescription services but has free admission receive arts pharmacy fund support for staffing costs to deliver?
Yeah, so typically when, if it's a free admission or free class or free performance, we make the donation based on just a general fund donation to cover that cost for participation. So, if it's and that's worked out with the partner. So if they say, great, admission to the museum is maybe $25 or $18 or $35, whatever that is, we make that donation, and then that just can go to, general revenue.
Awesome. We have another question from Lydia. How do we access the local field guide mentioned?
Yeah, the slides that will be shared after this those are all linked. And if I can pull it up quickly, I'll drop it in the chat here as well.
And then Lydia has another question. Sometimes there is resistance to healthcare systems in our state for a variety of reasons. Have you come across this at all? How do you suggest building trust with patients?
I think that is one of the um, beautiful pieces that social prescribing allows for, is that it allows for folks to engage with health improving and protective, engagements that have nothing to do with the healthcare system. It may, a prescription may come from there, and but when it's connected into a trusted community space, there's a lot more opening and a lot more opportunity for folks to step through the door. I think the other piece that, as much as mental health is talked about in this country, there is still a stigma around talk therapy and meds. And so while this, those are both really important pieces in the kind of biopsychosocial element of health, of whole person health, if you're not going to do either of those because you know, have a stigma against them, then you might as well get at least a third of that. And that's where I think the social prescribing part kicks in. We saw the arts field get called on for kind of a trust transfer during pandemic time of looking to support faith in vaccines and faith in public health measures. And it's, I think, a similar way that that the arts and culture sector can step up to really owning the value that they provide um, to people's well-being. I think one of the things that being in this role has empowered me to do is, I could say as a teaching artist, like, I see this impact, I feel this impact, but looking at the research has made me very, very confident in saying there is demonstrable impact on both physical and mental health, full stop, period. Like, and the research shows, and it's not just a dance class for adolescent girls. There's research that shows, regardless of the type of arts engagement, regular sustained creative practice shows impact. So I think it's a huge piece in being able to speak to our value as artists and art makers and community, like own that.
Has there been any talk about prescription as a preventative measure as opposed to a reactive measure?
Yes, there are a number of ways to kind of look at the utilization of arts and health. There's definitely the preventative measure kind of population health programs. We see this model in our work in higher education most often. So we're partnering, like UVA would be a great example. We currently work on Stanford campus and that it's a service that's available to all students and opening it up hopefully to employees in the coming year as well, to look at, people can use it as, if they're feeling like I'm not quite ready to go into the student health services, but maybe I want to be able to connect more, or maybe I want to do this so that I don't get to that standpoint. That is much more kind of the population health program look. And then there's also the kind of medicalized diagnostic version that is in response to a specific diagnosis or health concern.
Thank you.
Yeah.
Here's another question. Do art partners participate in a cost negotiation process? Are there times where they have to reduce their admission costs for this program?
So at this point in time, we cover full costs. We do look at, we always look at options that are cost efficient for members. So, but we don't negotiate. I think from the standpoint of both our founder and myself coming from an arts administration background, is that we understand like how much and how much arts costs to produce and to make and to run. And so at this point in time aren't interested in and aren't sending the kind of volumes of people that would allow for or make a kind of cost negotiation piece reasonable. So at this point in time, we, are able to reimburse at, whatever kind of the ticket price is.
Thank you. Okay, we have another question from Bama. Are participants dealing primarily with anxiety, social isolation, and emotional well-being like trauma recovery, or are wider applications being provided?
Yeah, I'd say kind of the primary health concerns that we see come through are depression, anxiety, or social isolation, or physical health concerns that those can impact. So looking at chronic disease management, such as controlling hypertension, um, supporting adherence to diabetes treatment, et cetera. So there's both the mental and the physical health impact.
Awesome, thank you. Okay, here's another one from Vanessa. How do you handle supplies to virtual participants?
Mm. That's a great question. So it kind of depends on the partners that we work with. Some arts organizations that are doing virtual classes have arts kits that we cover that cost, and they have that set up. In other places, if there's a specific need for like a very specific toolkit, then we help cover those costs as well for the participant. And in some cases, we look for partners that are, looking at how do we create with found objects in the home. So it's really based on what the programming need is. I will say from another access piece, beyond just the kind of tools that would be needed, we do also include companion tickets for people who need to take a caregiver or a loved one or a friend or a child along with them to be able to go. And in many cases, provide transportation support as well. That piece is also determined by the paying partner as to whether they are able to, include that, but the majority of our partners do. So that my lights just flickered. Just want to make sure, am I still connected?
Yes, you are.
Okay.
We're having some weather here too.
Yeah. Yeah. It's not even going that hard, but it was a flicker enough to make my heart go, oh, my Wi-Fi. Yeah. We take all of those access pieces into consideration. And thankfully, so far, the majority of our healthcare partners also recognize the piece of like transportation being a barrier that would really keep people from participating. So those are the kind of different ways that we look at supporting folks to be able to engage fully.
That's great. Okay, so this is a question from Michael. Asking, will evaluation of Stanford University's pilot program be shared publicly anytime soon?
That's a great question that I'm sure our research team and Stanford's partners would be able to share. I don't know, I don't have a date to say, when things are going to be published or put out, but as we see outcomes coming through, I think that will be shared to the extent that is possible.
Awesome, thank you. I'm going to save this one because it's kind of a little bit specific. And Bama has one more question that's a little bit more general. Do case managers have firsthand knowledge of these arts experiences, and how are they vetted?
That's a great question. So the referring provider who is, making the referral, writing the prescription for engagement with arts isn't referring to a specific program or a specific engagement. They are making the recommendation that their patient or their client engages with arts and culture to support whatever mental or physical health need they've identified as either meeting eligibility or being a flag for for potential support. The care navigators on the art pharmacy staff do have deep familiarity with kind of the programs in the area that they are serving. So when somebody comes in with a referral and they learn their arts interests and their access needs and all that good stuff, then they have at their fingertips the database of arts partners and all of the events and engagements that are being offered by those partners to be able to select, those that fit best. So we're able to narrow down for members to be able to select, something that they're going to feel really successful at, and not kind of spin their wheels on something. In the process of enrolling in the Arts and Culture Partner Network, the enrollment form collects a lot of information about access barriers that maybe need to take into consideration, or if there's specific elements about a program that make it a better fit for part of the population than others, whether that is, for age or, physical access needs. Maybe you're in an old building and there's not, and it's not ADA accessible yet. That's all okay, because we pull that in and tag it differently so that we know when we're making a recommendation that we take that into consideration to meet that kind of individual's needs. The other way that, from a partner standpoint, being an organization is, providing, many types of events. And so we make those kind of that tag and that notation at the event level. And so, if it's a workshop that is specifically designed for women or female identifying individuals, we want to make sure that that is tagged there so that we're offering it to the right people. So that's kind of how we vet at the kind of down to the event level as to whether it's going to be a good fit or not. We do a lot of work at the get-go to make sure that people, understand the standards of care and understand the agreements and kind of the types of programs that we pull in, so that they can kind of self-identify, oh yeah, this feels like something that I offer, this feels like something that I'm comfortable with. We provide a lot of resources for arts partners. Both, we do quarterly live webinars that kind of focus each time on a different aspect of either access or program design. Our last one we had in June was around healing centered trauma informed program design. We have one coming up at the end of October that's around learning styles, older adult learning styles, and program design to take into consideration the learning needs for that specific population. And so then we also have kind of third-party partners who provide trainings and certifications and resources that some are free and some are paid. But and we know that arts partners are at different parts in their own journeys and in their own capacity. And so I want people to be able to kind of tap in and utilize those as they're able to. If in the follow-up, after each scheduled event, if there is any feedback from participants or from members about, an engagement not being what they expected or enjoyed, then we're able to follow up with that very specifically to figure out what happened, whether it was a gap in expectation, or there was something kind of personal for that individual, or if there was something kind of broader about an organization, and we're able to address it specifically with that partner at that point in time. But we try to do a lot of the work on the front side so that we never have a member who has a poor experience at an engagement.
Is there anything that's not covered? I mean, it was a long time ago, but I remember reading the Daisy Fancourt book, and she talks about like people going to a movie all at the same time. Like, that's not as lighting up of your brain as, like, say, if you're in a live performance or something. So is there anything that we would consider arts that isn't under this?
So the piece in the standard of care that is around the creating space that is engaging is, as we look at, I'll take theater for example. during the pandemic, a lot of virtual theater that came out that maybe was filmed and is provided asynchronously. That's not something that I would connect people to because there isn't that like sense of that shared experience that we're
Right.
having together. Um, the That's probably the biggest or the best example of one that we have. We do have film screenings that are pulled in, but those are usually connected with other community conversations. And so that kind of, even though you're maybe watching a film,
Mhm.
having that shared experience, and then there's an interactive piece
So
afterwards.
there's an
It's typically,
engagement.
yeah, it's typically how um, we make sure that there's an engagement piece to that. Um, yeah.
So like I can't just go to like a Taylor Swift concert.
I mean, Taylor Swift would be an amazing concert to pull in. We don't have her in our arts and culture partners. Anybody has a line to T Swift wants to invite her to join, please share.
Make it happen. Okay. We have another question. This is from Robert, and he says, have art museums become providing partners to date? And he's asking if he as a university art museum be a pioneer?
Yeah, we have a number of university art museums that are part of the network in the Atlanta area. That's where I'm at. Oglethorpe University Art Museum is part. Um, I'm blanking on my geography. Kennesaw State is part, their art museum is part of it. SCAD is here in Atlanta that is part of the university system. Obviously, the Stanford Arts Organization, Arts Museums, the Canner and the Anderson Collection are providers to that population. In Massachusetts, we have a number. The Harvard Art Museums, the Brandeis Art Museums. We do have a number of the educational spaces that are providers. But even if you're not a pioneer, we still welcome you.
And just to reiterate, because I know you said that you guys are not, nationwide yet, but if people, because like I know like, UF is like, the head of, Shands has that huge program and they have, some great museums. So, if people in those areas that aren't covered now, if they like filled out your interest form, that might help give you leverage to kind of move into those states.
Yeah, it's a really important piece as we're talking with the healthcare side, and both healthcare side and other funders. I will say state arts agencies are one aspect that kind of have a general sense of where their arts organizations are, but to be able to say not just like that they exist,
Mhm.
but that folks have actively said like we want to be a part of this is a great piece to share with paying partners, prescribing partners, et cetera, that are looking at, okay, maybe there's, some interest, but what does it really look like? And we can pull up a map and kind of show a network that covers both urban and rural areas across whatever region they're looking at.
Awesome, thank you. Here's a question from Michael. It says, although our health system is quite different from the UK's, it seems like our workforce of peer support specialists would be uniquely positioned to serve as link workers and to co-create these experiences in communities across the country. Has Art Pharmacy ever engaged this specific workforce?
Yeah, so we have we have care navigators that are peer support specialists, community health workers, and teaching artists themselves. So, while there's not a degree in care navigation that anybody's coming out with, those are three fields that definitely have applicable kind of core competencies that we pull in.
Awesome. And so this one from Karen was a little specific, so I saved it for last. So I think she's with Stone Suit Storytelling, and they're very interested in utilizing narrative storytelling as a healing tool. And they've had several proposals and partnerships with veterans and children family interventions. Difficulty, I think, in measurements and getting folks on board. Can you help?
Yeah, I think and that is awesome. narrative medicine is an incredible field. The kind of suggestion that I would have in terms of measurement, kind of looking at specifically what impact you want to be able to demonstrate to, or that the veterans departments want to see for their participating families, would be good to look at kind of what scales exist. Finding validated scales such as the WHO-5 General Wellbeing Index it's a pretty simple index. It is 5 questions, gets a good kind of cross-section of somebody's well-being. It's a validated measure. It's not one that you have to create. Is a good option. Also asking that healthcare partner, what tools are they using that they would want to see, and to be able to measure against that is really helpful, because then you're not having to convince them to accept or value the scale that you've chosen to do. From a, it as a partner with Art Pharmacy, if we were sending people to you, we are not able to share specific health information with arts partners. We can give kind of a aggregate level change and impact, but we can't get down to the individual level for people. We can share that back with their referring provider directly, because we have the BAAs and the kind of confidentiality agreements in place. We don't go to that level of contracting with arts partners. So that's how we work, kind of treatment and passage of health data for folks. But if you have a direct relationship and a direct partnership with a referring provider, I would say, asking them what they're interested in looking at, and then being able to agree on a measurement scale is a great way to kind of disarm some of that resistance from the get-go, and kind of bring them on side.
Okay, and I have 2 more questions. I found one in the chat from Sarah. It says, what about cultural arts like Tai Chi and I don't know what the other one, I don't know how to say that, I'm sorry, that straddle the boundary between exercise, meditation, and performing art dance?
Yeah, so the kind of dance we categorize under our kind of movement. We have an umbrella, movement and dance. So we'll put those under kind of movement cultural experience tags.
Okay. And then finally, and I apologize if I mispronounced your name, but I think it's Olympia, has a question. Are registered artists and organizations like museums and schools able to partner through Art Pharmacy? For example, would a community center request artists for a group of clients with the same dance prescription?
We match people individually. We don't send cohorts of folks to classes. We have had experiences where there may be multiple Art Pharmacy participants at the same class, but they're not kind of connected and sent all as one. I think as arts-based social prescribing grows and we have a higher volume, there may be a time where we say we have a group of people who are interested in a painting class and there's not one in their area, and we can reach out to either a teaching artist or an organization and say, we are seeing the demand for, a class. If you were to produce one or offer one on a Saturday morning, but there's a number of people who might be interested in that, set that up and we can send people. But that's kind of how I would see kind of setting up a cohort at this point in time. Otherwise, we just send and connect people individually to experiences.
Awesome. I actually have a question about the teaching artists, just out of curiosity. Is there any kind of like requirement that you have for, the teaching artists? Like, years ago in Florida, like we were trying to come up with like a certification roster project. And so I just didn't know like if there was a like qualification that you looked for with a teaching artist?
We don't have anything that is required. We've got partnerships with ITAC and with Lifetime Arts that are both kind of have rosters of teaching artists that have demonstrated that they have some kind of certification with
Right.
Lifetime Arts is looking for folks working with older adults. International Teaching Artists Guild is, has their own way, but we have individual teaching artists who find us directly and are not associated with either of those. That then we like point back out to as additional resources specifically for teaching artists. If we're opening up and working with teaching artists to do one-on-ones with folks under 18, we ask for them to provide a background check. But yeah, so that's kind of the level of ways that we try to pull from folks who have rosters and then pull in folks who don't, but connect them back out to those that have additional resources for teaching artists to be able to support those individuals as well.
Awesome. Okay, so I did find some more things. So Leanne said, how will patients know this can be made available to them? Does Arts Pharmacy act as an insurance company for coverage? Will doctors communicate this to patients?
Yeah, so our pharmacy works with our partners to push that language out to the eligible patients. At this point in time, most of our partnerships are more on that kind of diagnostic side of things, not the public health programs. And so we're not doing kind of general public, call for individuals to sign up, because the likelihood that their plan or their provider is part of the network at this point is pretty slim. But we push out a lot through either the health plan or the health system or the local clinic that does have that partnership. So we do more targeted outreach.
Okay.
So but folks are curious, I do provider checks all the time on whether someone's kind of within network.
Cool. So are the arts providers required to have insurance?
They do not need to provide insurance to us specifically for it, but yeah, that's an important piece of working in business. So I would encourage that.
And then a question from Vanessa, how can we get our local hospitals involved? Is there some way to get them to connect with you? Who's a good point of contact in a hospital to introduce them to Art Pharmacy?
Great question. There are kind of multiple inroads. One is through the clinical side, through a behavioral health department, or through kind of a primary care physician. So you've got relationships with specific providers. That's often a way to get kind of the clinical side interested and engaged, and then they can take it to administration. The other side is to go to, the leadership around clinical innovation or health equity. If there's a health equity department, they're often also very interested in this because we take so much of the access piece into account. I have same on health plans. If you've got relationships with, local city-run or city-administrated health plans, there's often someone in there that's looking at kind of clinical innovation or a health equity piece as well. And then the way to connect them in, make an introduction to me. I dropped my email in kind of earlier in the chat, but I'll put it in here again.
And we'll include that in the email with the recording and the presentation as well.
Perfect.
We'll include Adrian's contact information.
Yeah, and then I'll loop in our sales and business development team to be able to take that conversation forward. What's often really helpful when introduced to the healthcare side of things through arts folks is that there maybe is that you can do kind of a warm handoff, and if it just wants to be a direct introduction, that's fine. That's great. If there's a close relationship already, that maybe you have, a program going already and want to really bring the conversation to like a scalable and introduce like the scalable aspect of it to the conversation, then, setting up a meeting together is also really wonderful so that kind of those stakeholders are all brought in and know that everybody is bought in, because it really does take kind of all of those different stakeholders to be at the table at once, or to be ready at once. And then once, that introduction has happened, we can take the baton and run. But that pass off either just as a warm introduction or as a like collaborative meeting together, both are wonderful.
Okay, and one more question. So, and you can clarify kind of where you're working, but you've mentioned national partners. So the arts pharmacy program is not South Arts state specific. Today is an awareness building service to US and the South by South Arts. Do I have that right?
Yes.
But you are in Georgia, which is
We're active in Georgia, and trying to build a network in the additional states in the South.
awesome. Well, I think we've answered everything. If I've missed anything, my apologies.
Yeah.
I'm just
These have
seeing.
been great questions, everyone. I know I'm trying to like scroll through also the chat. I love seeing where everyone's signing in from. I will also say I hold open office hours on Friday afternoons on a weekly basis. And so if you want to be able to come and ask more direct questions or kind of hear that model again, I love talking to people. I'll talk to you all day long.
That's great. We'll share that. If you'll send me that information, I'll share that
Yeah.
too in the follow-up email.
Yeah.
All right. So it looks like no one has had any last minute rushes to the Q&A. So I want to again thank you all for joining us today. Thank you so much, Adrienne. This has been so amazing, and it gives me hope for you guys to grow and for us to have arts prescribing everywhere. If you're interested in more of our professional development opportunities, again, you can visit our website and look for that email that will come to you with the presentation and some other resources. Thank you, everyone. Have a good afternoon. Bye.